Hello, I'm Dr. Alpana Parihar. I'm a senior consultant and chief of neuro anesthesia and neurocritical care at Apollo Hospitals, VG Road, Bangalore. I work as an anesthetist during all the neurosurgeries happening in the hospital, and at the same time I look after the patients in the neuro ICU as an intensivist. So in the neuro ICU we have patients who are post neurosurgeries who needs ICU observation. Along with that, we have a certain set of patients who have neurological issues like stroke or intracranial bleeds or subarachnoid hemorrhages or patients who are post neuro intervention or seizures. These are certain patients any patients who has neurological issues and needs observation in ICU. We manage all these patients in neuro ICU. So this is how we function in the hospital. Most commonly, the cases what we are doing, what fascinates me the most is one is neuro monitoring, what we do during our neurosurgeries. Very often when we see that the kind of surgery which we are going to do may have some neurological deficit because of surgical handling, and if at all there is a possibility which can be prevented by doing certain monitoring, certain neuro monitoring, which can tell us that this is the problem and we can probably prevent. In those cases we do neurophysiology monitoring, and there are different kind of monitorings for different kind of surgeries, and we do it regularly whenever needed. And this is something which I am fascinated towards a lot. And definitely the anesthesia what we manage for these monitoring is also different than the regular anesthesia. So overall, yes, this is very interesting thing in the neuro anesthesia what we get to do. And along with that, awake craniotomies fascinates me a lot. Perioperative care of subarachnoid hemorrhage is also an area where I'm keen on working, and I'm still learning. So this is about the work what I'm doing. And I'm often asked a question that what made me choose anesthesia, which is yes, a regular and common question, because the branch is little off track, little different from the regular clinical branches, and people sometimes wonder that what made you choose this branch. So I have a story behind this, actually speaking. So when I was a junior doctor, I had just completed my MBBS, and I was working as a resident doctor in a hospital. And what I observed constantly in the hospital was that whenever there is a patient who is crashing or collapsing, or who is critically ill and who needs immediate attention, or otherwise they'll crash, or sometimes they collapse completely and they just arrest. In all these situations, there was only one name which was called, and that was call the anesthetist, call the anesthetist, call the anesthetist. And this is something which was troubling me, that what is the anesthetist gonna do when the patient is crashing? They are there to give anesthesia. What are they doing here? And I just saw one thing, that it happens just the way we see in the movie. Suddenly they come like superheroes. They'll just enter the scene, they'll stabilize everything, they'll make sure that patient is safe, everything is safe, and as soon as things are in control, they also disappear like a Spider-Man. So this was something which was very impressive. I was very impressed, and I was I got completely crazy about this branch. I had not known this aspect of anesthesia, and this is something which fascinated me a lot. This was the time when I felt that this is something I want to do. This is like a magician. They just come, clear up everything and just go away. As a junior doctor, it is quite natural, because we don't know much in the hospital, and we just see how the things are happening. And I was still learning, and I was very happy seeing them working, and the kind of work they were having. Oh, this is something out of the operation theatre they do. And this is how I decided to be an anesthetist, and I love the work I'm doing. I'm really happy that I chose the branch, and I'm happy about the life what I wanted. I'm living the life. This life what I talk about is a life of an anesthetist or an intensivist what we are living. So this is very aggressive. We have sleepless nights, we have emergency hours, we have sometimes no work-life balance, and we have tough times. Sometimes it takes tolls on our health also, but with all those things, every patient who is recovering and going home, every patient who becomes better, and somebody who was into life-threatening situations is safe and now recovers, goes home, comes back sometimes and says, just to say hello to us. This is something which is so overwhelming. Like, this is the time I feel that it's all worth what we are doing, and this is something which keeps us encouraging to keep going. So this is how the life is of an anesthetist, and yes, I enjoy this life, and I hope that the people understand that anesthesia is not only about being inside the operation theatre, putting the patient to anesthesia, or just making them unconscious, and once the surgery is over, waking them up. This is not only the anesthesia. We are perioperative physicians. We look after their overall well-being during the surgery and also after the surgery. So this is a message I just want to give it to our society. Thank you.